Some new experimental cancer treatments are offering hope for people diagnosed with pancreatic cancer. The National Cancer Institute says the disease is the third leading cause of cancer deaths in the U.S. More than 67,000 people are estimated to be diagnosed with pancreatic cancer this year alone, and more than 52,000 are expected to succumb to the disease. But experts say these new therapies, in addition to chemotherapy, are making treatment more manageable and allowing people to live longer. I want to bring in Dr. Deirdre Cohen. She's the co-director of the Center of Excellence for Pancreatic Cancer at the Mount Sinai Tisch Cancer Center. So what are these new treatments?
Yeah, so we have some really exciting news that was just press released from Revolution Medicines about a KRAS inhibitor called daraxonrasib that has nearly doubled survival in advanced pancreas cancer and shown a 60% reduction in the risk of death. That's number one. The other findings that were recently presented at a national meeting showed a personalized pancreatic cancer vaccine that showed some very durable survival in localized pancreas cancer.
So, Dr. Cohen, rates of pancreatic cancer have been rising for years. You and I were talking earlier, all of us, during the break, about how difficult it is to screen for pancreatic cancer. I know that the pancreas regulates or helps with digestion and regulates blood sugar levels, but do we really need it? Can't we just remove it the way we remove an appendix and just be done with it?
Yeah, so one can live technically without their pancreas, but you will develop brittle diabetes, so it's very difficult to regulate your insulin levels. So that is an option were you to be diagnosed with a tumor that can't be segmentally resected, just taking part of the pancreas out, but it is not something you would do prophylactically, such as in a mastectomy, for example.
So is it because we've seen why has it taken so long to find these new pathways? Is it because historically in this country and perhaps around the world, we did not see the rates of pancreatic cancer that we're seeing now, and so it wasn't a priority?
I think that's part of it, but I think a bigger issue is that this gene, KRAS, which is mutated in over 90% of patients with pancreatic cancer, has been really undruggable up until now. And so this is really quite an advancement in being able to target this gene, which really, is like pushing on an accelerator and driving all of the growth and division of the cancer cells.
I mean, that you talked about the personalized vaccine. That made me kind of go, oh, okay, wow. When could people have access to these treatments?
Yeah, so the vaccine is earlier on in development. So the study that was recently presented was testing safety, and so it's now in a phase 2 setting looking at efficacy. So it'll be a little while until we have that available, hopefully. And the oral drug that is targeting the RAS mutation is likely, hopefully, to be approved later at the end of this year or early next year. So that's really close to being on the horizon for our patients.
So, 20 years ago when I was working in finance, there was great excitement when we began to map the human genome, right? And I remember part of the pitch that we would make to investors for the companies that were developing this research was that, at some point doctors will be able to pinpoint cancers and accurately target them. So I wonder if this is something that what's happening here in this particular case is something that can be used for other cancers. In other words, I know cancer is very specific and medications and treatments are very specific, but is this research and the research that's gone into developing this something that can be more widespread?
Definitely. So RAS mutations are found in up to 30% of all cancers, and in particular, in addition to pancreas cancer, colon and lung cancer, which are some of the top cancers that are diagnosed globally. So this has very far-reaching effects for solid tumor and liquid tumor treatments.
All right. Well, Dr. Deirdre Cohen, really appreciate you being here and bringing us some positive news.
Some positive news when it comes to cancer, because we can need it. Yeah.